Hi, I'm Amy from Eastside Wellness Chiropractic. The next exercise in our active care series is a Cook hip bridge. You can see this Cook hip bridge also in our hip progression, but we're going to take this right to our single leg position using this ball. What Dr. Brian's going to do is he's going to wedge the ball between his torso and leg, right in that crease where you bend. So we're going to give him the ball. If you don't have a ball, you can use socks rolled up, you can use a towel, but something relatively that size. You can even use a tennis ball. Now, with this, there's some specifics that we want to make sure we target. When Dr. Brian has this foot planted, he's going to draw the toe up so that he's only pushing through the heel. Next, he's going to lift his arm straight up in the air. However, when doing so, he wants to make sure he doesn't kind of have lazy shoulders that ride up towards his shoulder. He wants to make sure he locks them down in those lats. Finally, what he's going to do is he's going to drive through this heel, and he's going to push his hips up into the air as far as he can, getting them to fully extend. Now, he is going to come down nice, slow, and controlled. It should take him about twice as long to come down. Sometimes you have a problem where the ball doesn't seem to want to stay. If so, you can get something even maybe just a little bit bigger. But what he's doing is he just wants to make sure that his leg stays in this position, in this fully hip flex position, which Dr. Brian can do. However, this ball, if you're having trouble doing so or just remembering, just kind of helps to remind you to do so. So if he brings his knee up and he locks this ball in, pressing his hips all the way up so that he extends all the way through the hip flexor, and then slow and controlled coming down to the floor. You're going to repeat this 8 to 10 times, and then you'll switch and do the same thing on the other side.